Hi, I'm Dr. Sandeep. Welcome to my channel Single Sheet Dentistry. Today's topic of our discussion is about tertiary dentin. Coming to the topic, tertiary dentin. Unlike the primary and secondary dentin, which are formed as the physiological process of deposition, tertiary dentin is formed in response to external stimulation or irritation to the tooth structure. The stimulus can be thermal, mechanical, evaporative, or chemical. Some of the few examples include attrition, abrasion, abfraction, erosion, and caries to the teeth and trauma to the tooth, or irritation from the restorative materials are the some of the external stimulus which causes irritation to the tooth structure. During this external stimulation, odontoblasts, the cells which produces dentin, they are either cut or exposed. They may either die or survive based on the extent of the injury. Based on the severity of the stimulus, tertiary dentin is divided into two types. If the stimulus is mild and the odontoblasts get degenerated or they survived after the impact stimulation, the remaining odontoblasts which survived the impact will produce or secrete a special type of dentin called as reactionary dentin. As you can see in the picture, this is the reactionary dentin which is produced in response to the caries attack. If the stimulus is aggressive and the odontoblasts cannot withstand the impact and they get degenerated during the process of stimulation, the undifferentiated mesenchymal cells, these are the progenitor cells which are present in the pulpal tissue, they differentiate to form a new odontoblasts in the site of the action, and they produces a special type of dentin called as reparative dentin. Coming to the structural changes, there is no structural continuity seen between the tertiary dentin with the other types of the dentin. Dentin is comparatively less permeable. Dentinal tubules may be less or they may be absent. With the process of aging or the stimulation of the tooth structure, the pulp chamber may get obliterated due to the deposition of dentin within the pulp chamber. Reactionary dentin shows structural changes like they shows change in the direction of the dentinal tubules compared to the normal primary and secondary dentin, whereas the reparative dentin, it is heterogeneous in pattern. It is not at all similar with the normal dentinal pattern. It is somewhat organized in case of tubular pattern, whereas it is unorganized in case of fibrodentin and osteodentin. Coming to the clinical aspects of the dentinogenesis, the remaining dentin thickness. Remaining dentin thickness is the amount of dentin present between the floor of the cavity, that is the cavity what we prepare after the caries has initiated, to the roof of the pulp chamber, is considered as remaining dentin thickness, that is RDT. Why we are discussing it is, if the remaining dentin thickness is greater than 0.5 mm or greater than 500 mm, the reactionary dentinogenesis process takes place, that is and which are existing pre-existing odontoblasts produce dentin. If the remaining dentin thickness is less than 0.5 mm, that is up to 250 mm, 250 mm, reparative dentinogenesis process takes place. If the RDT is less than 250 to 40 mm, poor reparative dentin formation takes place. Remaining dentin thickness, why it is important? Liners, bases, and varnishes are the three materials which we are used to support the cavity or else support the tooth structure, used to support the tooth structure which we are placing at the base of the cavity. If the remaining dentin thickness is 1.5 to 2 mm, there is no indication of any of these materials while the cavity preparation. It is 1.5 to 1 mm, Jedwali liner is indicated in case of restoration. If it is 0.1 mm, calcium hydroxide liner is indicated in case of if the RDT is 1 mm. For more such videos, please subscribe to my channel Single Sheet Dentistry. Thank you.